Get ready, stand by, master course, first episode, Dr. Kang Chun-gyu, stand by, 3, 2, 1. I run K Dental Clinic. I am Dr. Kang Chun-gyu. I have graduated in 1987, so I've been a dentist for approximately 30 years. Because I was given the first lecture, I feel a lot of stress, but I feel honored at the same time. Master course is the same as navigation in terms of implant world. Even if you have never done implant surgery, you'll be able to place the implant in the correct position and do appropriate prosthesis. You'll be able to maintain it correctly and prevent any complications even after a long period. I'll try my best to provide the guidelines in an organized way. The contents. Why do you need implants? Dental implant advantages and disadvantages. What is a dental implant? Indication, contraindication. History of dental implants will be looked at. And then I'm going to address what is osseointegration. I'm sure some of you know it. It's very basic, but at the same time, it's very important, so we're going to gloss through it. Let's think. Why do you need implant? Before implant became more available, we provided bridges or dentures. However, as implant became more commercialized, the implant can cover a lot of disadvantages of bridges and dentures, and it has its own advantages. In the missing area, implant can provide optimum function. That is why implant is necessary. First, let's look at a couple of clinical cases and think of why we need implants. This is the first case. This patient has been using denture for a long time. The patient came in. So this was the state. On the right, surveyed bridge was separated and the crown post fell out. For a long period in the missing area, concentrated force was applied, and as a result, the surveyed bridge was dislocated and it fell out. If the patient received implant treatment from the start, in the top left, the surveyed crown would have remained as a natural tooth, and the bridged tooth, the patient would have been able to use it for a long time. Let's look at a second case. In the lower left quadrant, the two molars were missing, and the two teeth on the front, the surveyed crown was used and a partial denture was used. As the patient used this for a long period, a problem erupted in 2009. The patient used it like this, and after 7 years, when the patient came in within the surveyed bridge, there was decementation and caries occurred and retreatment was required. The root itself was sound. Re-endo treatment was done and implant was done in the missing area. If the patient had received implant treatment from the start, the two surveyed crown, patient would have maintained natural teeth for a long time. Let's look at a third case. In the 3 missing areas, 7-unit bridge was done. As you can see, this was long bridge, and in number 24 and 25, the surveyed crown tooth, the clinical crown was very short and decementation occurred, and there was mobility. I removed the bridge, and when I did retreatment, I could not do bridge. So in the front and the back, the surveyed crown was changed with crowns, and in the center, the missing area, 2 implants were placed, and 2 months later, prosthesis was delivered. This is before treatment. and the implant was used for retreatment and prosthesis was delivered. If the patient had received the implant from the beginning, the surveyed crown area on right and left, they would have remained as natural teeth for a long period. Let's look at a fourth case. The 2 teeth in the middle were missing and 6-unit bridge was done, and after a long period, fracture occurred in the center and retreatment was required. In the missing area, 2 implants were placed and prosthesis was delivered. In this patient, if the missing area was restored with the implants from the beginning, the adjacent teeth would have remained as healthy natural teeth. Fifth case, the most distal molar was missing, the 2 teeth in the front. Cantilever bridge treatment was done. In the past, implant treatment was not done frequently, and this was done instead. However, in the most distal area, when there's occlusing force, the tooth in the front, the leverage force is applied there and decementation occurred and caries was observed. Retreatment was required. The tooth in the front, I did endo treatment. Crowns were placed in the 2 teeth and in the missing area, implant was placed. This is the same for the patient. If implant treatment was done ahead, the 2 teeth in the front would have been maintained as natural teeth. Sixth case, this patient has been using partial denture in the upper and lower for a long time, and the patient's chief complaint was that the patient experienced too much pain to chew anything. Telescope crown was done and the patient was wearing denture in upper and lower. If you look at the patient, when the denture was removed, on the palate, there's a very severe sore spot, and whenever there was food in there, it would be stimulated, and the patient was not able to have a meal because of pain. Implant was placed, and immediate loading was done, and final prosthesis was delivered. If you look at the completed image, the palate has been restored to a normal state, and when the patient chews, the patient does not feel any pain and can eat with ease. In the lower, denture was removed, and in the missing area, implant was placed, immediate loading was done, and prosthesis was completed. If implant treatment had been provided from the start for this patient, the patient would not have experienced such difficulty or pain and would have been able to eat as if he or she was using their natural teeth. This is the final case. As you can see on the left, the teeth are missing, and on the right, implants were placed and unilateral mastication was done. Due to overload on the implant, as you can see in red, radiolucent line was observed. On the left, implant treatment was done. 2 years later, as you can see, as shown in red, radiolucent area has disappeared and a normal bone has been formed. Most dental disease is caused by overloading, and it's obvious to experienced clinicians. It's especially so for periodontal diseases. If you do implant treatment, overload is not applied and force is dispersed, so the remaining teeth can be used in a sound manner for a long time. In missing area, implant treatment is the optimum option. Let's look at pros and cons in detail of implant treatment. First, compared with denture, what advantages do implant have? As you know, denture, there's irritation, discomfort is very significant, and it stimulates the soft tissue, and people have resistance towards denture. Another problem is that the most distal abutment receives most of the load from the missing area, and it can lead to problems. On the other hand, regarding implant, it's very similar to natural teeth, and it has stronger masticating force compared with denture, 5 to 7 times stronger. Denture compared with natural teeth, it's approximately 20%, and as for implant, it's 80%, and it can restore masticating force. In that way, implant forces dispersed and the lifespan of remaining teeth can be improved. If you look at the multiple literature, RPD's average lifespan is approximately 5 to 10 years, and for abutment, it's approximately 5 years, so it's shorter. Let's look at another Korean literature. According to the conclusion, RPD, if it is meticulously maintained, you can use it for 7 to 9 years. However, if it is not maintained properly, it is not as long, and as for abutment, it becomes even shorter. The lifespan is approximately 3 to 5 years. This needs to be discussed with the patient in advance. The bridge and implant, let's compare the two. The bridge, you need to prep the abutment, and the occlusing force goes to the abutment. If you use it for a long time, Decementation of abutment can occur as well as periodontitis. According to literature, 20-year survival rate of 3-unit bridge is 73%, and the main reason of failure is caries. And this is due to decementation caused by long-term overload on abutment. Such situation can occur more frequently if the path is bad among abutment and if clinical crown is short. As shown, in 3-unit bridge, on the abutment, caries can occur, as well as periodontal disease or abutment fracture. Such situations can occur frequently. On the other hand, natural teeth can be maintained if you use implant, and overload is not applied to abutment, so adjacent teeth can be maintained in a healthy way. Let's compare bridge and implant. Bridge, in missing area, the abutment on both sides, overload is applied there. However, if you use implant treatment, force is dispersed. Let's look at the first case. In this patient, number 16 was missing and 3-unit bridge was done. One day, the chief complaint was that the upper right side, the patient experienced discomfort and pain due to decementation in abutment. Caries occurred, and as you can see, caries occurred with time. Endo treatment was required and retreatment was required. As we did retreatment, the tooth was slightly mesially tilted. Orthodontic treatment was done. In number 17, endodontic treatment was done, and implant was placed. Prosthesis was delivered. 2 years and 6 months later, results are still stable. The same patient in the upper left quadrant, in number 27, the crown, there was perforation and retreatment was required. In this case, bridge treatment should not be done. So crown treatment was done. In missing area, implant treatment was done. If you look at the second case, this is one of the biggest side effects of bridges. So in the upper right, there's an odor, and the patient also complained of pain when the patient was chewing. And there was periodontal disease in the abutment area. Mobility was very severe due to periodontal disease, and tooth was extracted. And in that area, In order to place the implant immediately, effort was made. However, the ridge was very narrow, so socket preservation and GBR was done. 5 months later, when we revisited the site, primary closure occurred nicely, and now we can place the implant. Implant was placed, prosthesis was delivered. If you look at before and after, appropriate GBR and socket preservation was done. Originally, it was a difficult implant case, but the situation has turned favorably. Ways to achieve such a favorable change will be addressed in a GBR sample lecture and advanced course. Implant is not without shortfalls. Let's look at disadvantages of implant depending on patient and dentist perspectives. From the patient perspective, first, the treatment cost is quite expensive. However, these days, implant treatment can be insured and the treatment cost has been reduced, so this is not a huge factor. Second, treatment period. Compared with other prosthodontic treatment, implant treatment can take slightly longer, at minimum 2 months to 3 months. So it's slightly longer than prosthodontic treatment. Additionally, there's fear of surgery. From a dentist perspective, compared with other treatment, it requires a lot of clinical knowledge and experiences. Second, if it fails, it is difficult to achieve full recovery or period of treatment can become elongated. Thorough oral hygiene and regular checkup is also essential. However, implant has many advantages and it can overcome such disadvantages. Now, let's talk about what is dental implant. Implant is what you put in. If you look at the word, let's look at the etymology. Inside, and plant, which is planting. It's a mixture of these two words. So, implant stands for what you put inside human body. It can be dental implants, intraocular lens, or artificial joint. They can all be considered as implants. Let's compare graft and implant. Graft stands for vital material inserted into the body to replace organ, kidney transplant or liver transplant. You can think of graft in line with these. As for implant, it's non-vital material inserted into a body to replace a certain organ. It includes metal, silicone, and plastic. Regarding metal, for dental implants, titanium is used frequently. Let's look at dental implant. It replaces the root of missing tooth, and our body does not resist this artificial tooth. If a healthy tooth due to caries needs to be extracted in order to restore it, we can use dental implants. Let's look at indication and contraindication. Implant indication includes complete edentulous ridge, partial edentulous ridge, and missing single tooth. All cases where teeth are missing, implant can be applied. Contraindication. It's the same with other dental surgery. If there's a systemic disease that cannot be controlled or if there are psychological issues, implant treatment cannot be provided. Unlike general surgery, implant is directly related with bone, so implant treatment cannot be provided to growing patients. Also, special care needs to be paid for osteoporosis patients. Implant treatment can be provided in cases where teeth are missing, and if the patient wants it and if systemic health is favorable, such treatment can be provided. History of dental implants. Let's look at them briefly. In the ancient days, rock and ivory was used, the dead or as a temporary measure. In the medieval days, it's kind of funny, but tooth from another person. In other words, a tooth of a poor would be taken out and would be transplanted on the rich. In my opinion, I think it had very low success rate. Modern day implant. Let's look at history. It started from 1930s. Multiple materials and shapes of implants were used and developed. The most important modern-day implant concept was first established by Brånemark in 1965. On the left is the patient who received surgery for the first time, and on the right is Professor Brånemark. Osseointegrated implant was first started by Professor Brånemark. In 1952, in Rumte University, Sweden, a orthopedic surgeon, Professor Brånemark, as an effort to understand bone healing process, he put titanium optic chamber in rabbit's leg. When the research was over several months later, he tried to remove the chamber. However, he couldn't because it was stuck in the bone. And he named this phenomena osseointegration. Osseointegration. It is direct structural and functional connection between living bone and implant. As you can see, there's nothing in between bone and implant. This is osseointegration. On the right, in the middle, there's soft tissue. In other words, fibrous encapsulation has occurred, and this leads to failure in osseointegration. Osseointegration. On the surface of the implant, the soft tissue is not attached and new bone is firmly fixated. That's called osseointegration. As shown on the surface of the implant, directly new bone is formed. This is a SEM image, and you can see new bone is formed directly on the implant surface. There's a very important terminology, BIC, which is bone to implant contact area. Total length of implant surface by new bone to implant contact length is BIC. It shows how well osseointegration has occurred. It's shown in percentage. The higher the BIC, the better the osseointegration. So when you develop new surface with animal study, you check whether BIC has increased and whether osseointegration has improved. As you study implant, this is something that is going to come up repeatedly, so you should remember this point. Additionally, in 1981, on osseointegration and the importance of it, 6 criteria have been released. First, biocompatibility of implant materials, implant design, implant surface. These 3 are related with material. Fourth, the state of the bone. It's related to the patient. Fifth, surgical procedure. Sixth, load condition. The last 2 are related to the surgeon. The details will be addressed in basic course and offline course. Let's look at the summary of what was discussed. This has been the first lecture of Implant Basic course. At first, it may seem difficult and foreign, but if you have accurate aim and purpose and continue to advance forward, you'd be able to get good results. Master course will help you find your way. I hope you continue to show interest. Thank you for watching.
감사합니다.